So in this video, I'll be talking about 5 contraceptive methods for women, each with their pros and cons. Now, when it comes to contraception, there's no one size fits all, and there are several factors you have to consider before you choose an appropriate contraception method for you. Some of these factors may include your medical history, the cost, the effectiveness, and your future fertility plans, and also how convenient is the contraception method. So the first on my list is emergency contraceptive. Now, this is by far the most common and most popular method of contraception out there. So for example, you have Posino 2 and Post-P tablet. Now, these tablets, they contain a progestin called levonorgestrel. And the way it acts is that it's when you take it, it helps to prevent or delay the release of egg. Now, take note that emergency contraception is not meant for regular use. It is something that you use as an emergency prevention. Now, the effectiveness of emergency contraception, it depends on the time at which it is taken. Now, when you take Post-P or Postnatal tablets, it lasts for about 32 hours. But it is more effective or most effective when it's taken within 24 hours of unprotected intercourse. That is when it's up to 95% effective. If you take it maybe after 48 hours, the effectiveness begins to reduce. I love that most times people experience a lot of failure rates with emergency contraception. So the major pro of emergency contraception is that it is convenient due to its once dosing. You just take 2 tablets and then you are good to go. But some of the cons include number one, it is less effective in women with a large body mass index. So women that have a very large weight, like as from 90 kg and above, this emergency contraception tend to be less effective for them. And then some of the common side effects include nausea, vomiting, breast tenderness, abdominal pain, and the most common and most concerning one is that it causes menstrual changes. So you can have delayed periods or more earlier periods when using postnatal, and then it can also lead to spotting in between periods. The second contraceptive method is family planning tablet. That is a common name. So an example of this is Levofem tablet. It's a very highly effective contraceptive method with success rate of up to 99% when you take it consistently and correctly. Now, the correct way to take this Levofem tablet, number one, by starting at your menstrual cycle and taking it once daily for a period of 1 month. So that is about 28 days. Taking that this one is very much different from an emergency contraceptive, and you can't use it as an emergency contraceptive. It's taken once every day in order to have that contraceptive coverage. So some of the pros are, one, it is more effective than Postinor 2 tablets, and then it helps to regulate menstrual cycle, and it can be useful in PCOS in order to restore hormonal balance. So some of the cons, it requires you to take a tablet every day, and you missing this tablet means that the effectiveness of the contraception begins to reduce. And then also it can lead to spotting between periods, mood swing changes, and then even breast tenderness and reduced appetite. The third on my list is injectable contraception. Now, the prominent example of this is Depo-Provera injection. Now, take note that this is a prescription-only medication. You can't get it over the counter in a pharmacy or something. Now, Depo-Provera, it has up to 99% effectiveness of contraception. And the good thing about it is that it requires just 1 injection every 3 months. So in total, 4 injections a year is very effective for contraception. So the pros, it is a convenient alternative to swallowing pills daily, as you just have to take 1 injection every 3 months, and with 4 injections in a year, you are covered for contraception. And then it can also help to reduce bleeding. The cons of Depo-Provera injection is that it can delay fertility for up to 1 year, even after stopping the injection. So imagine stopping an injection for 1 full year, and for the next year, you are not able to conceive. So that's one of the cons of Depo-Provera injection. And then it can also lead to other things like osteoporosis, that is weak bones, and sometimes some irregular bleeding outside of periods can occur. Number 4, we have implantable contraceptives. Now, these are contraceptive devices that are implanted in the upper arm and is effective for up to 3 to 5 years, depending on what exactly you want. So the pros of implantable contraceptive is that fertility returns to normal immediately after the implant is removed, and it is safe in breastfeeding mothers. However, some of the cons of implantable contraception may include pain at the site of insertion, and then it can also lead to bleeding, acne, breast tenderness, weight gain, and mood swings. The last one on my list is called IUD, intrauterine device. Now, this is a T-shaped device that is inserted into the uterus, that is the womb, in order to prevent pregnancies. Now, this is done by a healthcare professional and is usually done after birth. So, how does it work? It works by preventing fertilization, by preventing the access of sperm cells to mate with ovum. So, therefore, fertilization is stopped and therefore pregnancies are prevented. And so, it is over 99% effective, and it can be used for a long period of time, up to 3 to even 12 years. And immediately it is removed, fertility returns back to normal. Some of the cons of IUD include: 1, there can be discomfort at the site of insertion. Secondly, the device can on rare occasions move out of place or fall out, and then it can also lead to more heavier bleeding during periods or more painful period, and then it can also lead to irregular bleeding, that is even outside of when you are having periods. And lastly, it can lead to an increased risk of pelvic inflammatory disease. So like I said at the beginning of this video, there are several factors you have to consider before choosing a contraceptive method, and there's no one size fits all. You have to talk with your partner and then talk with your doctor so as to select the one that is best fit for you. Thank you very much, and I'll see you in the next video.